This COVID-19 Toolkit for Businesses gives an overview of the case investigation and contact tracing process during the COVID-19 pandemic. It gives you the tools to contain any infections and exposures in the workplace. First, some definitions. Isolation. To prevent the spread of disease, someone who is sick or has tested positive for COVID-19 separates from healthy people by going into isolation for a minimum of 10 days. Isolation means staying away from other people, even in your own home. If you are in isolation, that includes staying home and not sharing a bedroom or bathroom with healthy family members. If you test positive for COVID-19, begin isolation immediately. Begin making a list of your close contacts. You will be released from isolation once the following criteria have been met. First, 10 days have passed since symptoms first appeared, or since 2 days before your test date if you are asymptomatic. And 24 hours with no fever or fever-reducing medications, and your other COVID-19 symptoms are improving. Please note, you do not need a negative test or a doctor's note to return to work. Quarantine helps prevent spread of disease that can occur before a person knows they are sick, or if they are infected with the virus without feeling symptoms. When you may have been exposed to the coronavirus, you quarantine by keeping yourself away from other people. If you come into contact with a virus, you don't get sick immediately. It takes some time for the virus to invade your body and replicate itself. The time before you start to show symptoms is the incubation period. The incubation period for COVID-19 can be anywhere from 3 to 14 days. Many people will start to show symptoms after 5 days, but the most current research shows that many people who have COVID-19 don't show symptoms for as long as 14 days after infection. Regardless of when symptoms show up, and many people become infected without ever showing symptoms, you can transmit infected particles to other people at any point from day 1 to 14. That's because as soon as you are infected with a virus, your body starts producing thousands of virus particles that you can transmit to others when you speak, cough, sneeze, or even breathe heavily. The safest option, and the one that is most likely to slow the spread of COVID-19 among your employees and customers, is to quarantine for a full 14 days while monitoring symptoms. However, there are 2 additional options to reduce the length of quarantine if you have no symptoms and provided you can wear a mask at all times and stay at least 6 feet away from people at high risk of becoming seriously ill from COVID-19 for the full 14 days. If you show any symptoms of COVID-19 during that time, you will need to isolate immediately and get tested. The shortened quarantined options are as follows. First, a 10-day quarantine if there have been no symptoms, followed by 4 days of monitoring symptoms, social distancing from high-risk individuals, and wearing a mask at all times. Second, a 7-day quarantine if there is a negative result from a PCR test taken on or after day 5 of quarantine, followed by 7 days of monitoring symptoms, social distancing from high-risk individuals, and wearing a mask at all times. If your test results are not back by day 7, you must continue to quarantine at home until you have received them. Please note that getting tested before day 5 could result in a false negative. To avoid that, the PCR test should be taken on or after day 5. Talk to your doctor or testing site to make sure you're getting a PCR test because a PCR test is more reliable for people without symptoms. And here are the new quarantine timeline options for close contacts without symptoms. A close contact is someone who was within 6 feet of an infected individual during their infectious period, or who had personal contact with them, a handshake or a hug, for example, during their infectious period for at least 15 cumulative minutes within a 24-hour period. The infectious period is considered to be 2 days before symptoms began, or 2 days before testing positive, if asymptomatic. Individuals are still considered close contacts if masks were worn by both people. If you have had contact with a close contact, you are a contact of a contact, and you do not need to get tested or quarantine because you are not considered to have been exposed to the virus. A contact of a contact is an individual who has been around someone who is deemed a close contact. If the close contact you were around later tests positive and was infectious while near you, then you would become a close contact and need to begin a 14-day quarantine. Contact tracing is an effective disease control strategy that involves identifying cases and their contacts, then working with them to interrupt disease transmission. This includes asking people who are sick or who test positive for COVID-19 to isolate and asking contacts to quarantine at home voluntarily. Contact tracing is a key strategy in slowing the spread of the pandemic.